try to send these obese ladies to us before you embark on ovulation induction or IVF, because I've seen it several times.
Yes.
They go through all your tough procedures,
Yeah.
and then they come back to us, they lose weight, they get pregnant.
Yeah.
So please, before doing anything, send this to us. Let
That's
us
correct.
try.
Yes, inshallah.
Can I ask Mrs. Ghadir while we're having more questions? So I'm sure you have a lot of people that will stick to your diet and will lose weight. Now, after they lose weight, sometimes they lose the motivation to continue on this diet. So how do you encourage people to stick to the diet and to avoid going back to obesity?
That's a very good question, and I think a big part of that comes with behavioral therapy. Change is never easy, and initiating change is always the hardest step. So I think once they start on that journey and once they see the results, they themselves would be more motivated to stick to the diet, and especially once they reach their end goal. It's important when we first sit with the patient to understand why they want to lose weight and what they hope to accomplish after that, and not only to establish a short-term weight loss plan, but also to establish a long-term plan. So even after losing the desired weight, how do we maintain that weight loss and how do we keep that weight away? So if their initial issue was fast food every day, so how can we reduce those bad eating habits so that they could be happy, they can still enjoy the foods they like to consume, but at the same time they can also reach their end goal.
So it will like become a habit, they get used to it. Thank you. Dr. Abdel Nabi?
People with obesity. Thank you, Dr. Jamil, for the excellent presentation, really. Now, people with obesity and complaining of sub-infertility, do they improve their fertility when they lose weight, either by surgery or by pharmacotherapy?
Absolutely.
Do you have data for that?
Yes,
proving that?
actually, most of the obese patients who have only the ovulatory problem that affects their fertility, they will have normal ovulation and they will have spontaneous pregnancy without assistance. And we saw it a lot. Like we ask a patient to reduce weight before we start the IVF cycle or we start ovulation induction, and she will come to us telling us just, I'm pregnant, I don't need your medications.
Do you need a certain level of weight loss which can improve drastically?
A limit.
Yeah.
Actually, we accept cases for IVF treatment up to a BMI of 35, which I don't agree with. I mean, outside Kuwait, the limit is 30 kilogram per meter square. No one accepts more than 30 for free treatment, but it's politics.
Dr. Abdinabi, for in general rule, if she loses 10 or more kg, she has high chance to get pregnant.
Yes.
No matter what's the baseline. And instead of going into ovulation induction high doses, first lose weight. Then if this fails, then you go into ovulation induction.
Any questions?
Someone has a question there? Anyone? Okay. Can I ask Dr. Jamila? Now, as you said, a lot of obese people have difficulty to conceive, whether men or women, and you're trying a lot of procedures or tablets, medications. Now, in terms of losing weight, what kind of efforts or policies that you have in your center to encourage people to reduce weight, to be able to conceive rather than to go to medications?
Well, we ask them to go back to to the surgeons or to the endocrinologist just to give them some medications, like you can give Saxenda or any other medication, just to lose weight or to do bariatric surgeries, because we have a lot of patients with a BMI of more than 40 or 45 who insist in starting the IVF cycle. They will tell us it's okay. Many patients had the cycle in a private sector with this BMI and they had babies. I mean, we cannot do anything, other than just asking them to go back to their doctors.
But at least we can encourage them to lose weight beside the
It's just
medications.
putting the rule that we will not accept this case if the BMI is more than 35. We just put this rule, and this is a kind of encouraging for them to lose weight and do something.
Great, thank you. Any more questions?
No limit. No limit in private.
Yes, Dr. Abdel-Nabi. Can we give him a mic, please?
For weight losing management, do you think exercise versus diet management, which is give more better results? I know you need to do them both.
Mm-hmm. I think they're both equally as important, but it's also depending on the person's lifestyle. So if a person works very long hours, or they don't have the time to exercise throughout the day, so maybe we can figure out a way where they can incorporate small physical activity throughout the day rather than having an hour of physical activity. So simple things that we always recommend to people is don't stay for long sedentary hours sitting down. So always set a timer for at least an hour, eat wherever you are, even if you're at work, if you don't have time to exercise, just don't stay seated for a long period of time. So if you're doing a desk job, set a timer for 1 hour. An hour, go get a cup of water and come back. So always try to move and not stay sedentary for too long. And in regards to diet, we try to work our way around that. Maybe reduce their calorie intake just a bit more to help accommodate for the fact that they're not exercising. But a combined treatment of both is what's recommended.
So the Kuwaitis are the most big people in this universe.
Yeah.
Now, what's wrong with us? Is it because of our food, the time? I mean, why we're so obese? Why?
What causes obesity? So many different
Is there something wrong with our quality, quantity, our way of eating? I mean, what's the wrong?
I think there are a number of different factors that contribute to the obesity epidemic here in Kuwait. And I think when weight first started to become a major issue was during when fast food restaurants were introduced in Kuwait. Before then, people wouldn't have a fast food restaurant at every corner. Fast food has become easily accessible. And Kuwaitis, as I said, all of our social gatherings are surrounded with food. So we can't just go out and enjoy yourself. It's always, let's go to a coffee shop, let's go to a restaurant, let's go eat. So even when we are trying to do something fun, it's always associated with food.
That's why it's difficult in Ramadan to go anywhere, because we need to eat every time we go out. Well, thank you very much for our eminent speakers.